And then you can use the acetate preparation as well. You can use a trichogram as well, because some of these mice do lay eggs attached to the hair shafts. So you can find the eggs on a trichogram. That's the example here. Lice and Calyptella will attach their eggs to the hair shaft. The big difference between the two is the size and also the length of a lesion. So with Calyptella, you have a smaller egg, and it's only adherent to the hair shaft by its tip, and you can see little filaments, whereas the lice eggs are much bigger, and it adheres to the hair shaft on most of its length. Do you see the difference here? It's mostly attached here, most of its length, whereas here it's only just really by the tip. Okay, so now we're looking at a different presentation. And you have a sequence of 4 lesions. Obviously, at any given time, you may have all 4 lesions or just 1 or 2 types. But this is how a bacterial infection is going to look in a dog, and this is going to be more visible on the non-haired or the less haired areas of the body, like the belly, the armpit. So it starts as a red bump, also known as a papule. Then the papule is going to transform over time into a pustule, so you're going to have a collection of pus and the development of a white head. Once the pus has accumulated within the pustule typically ruptures, the pus dries out, and now you have a crust that is initially very adherent, but with time will dry out and fall off. And now you end up with the foot plate, just a mark of the help me out here. The foot plate of the crust, really, which is called an epidermal colorate. So that scaly ring here is just the foot plate of the crust that has fallen off. So the papule and the pustule are called primary lesions because those are the early lesions, and those are due to the disease. The secondary lesion means that the dog has probably itched and kind of caused that crust to fall off, or it's just due to the natural regression of the disease. So that's what we call primary versus secondary lesions. So typically you don't see these lesions with malassezia. The malassezia is just on the surface of the skin. This is typically a bacterial infection. Okay, so when you see pustules, papules, crusts, and epidermal collarettes, you should assume it's a bacterial infection. Okay, we've already gone through some of these, so I'm just going to go over the skin cytology. It's a little bit different in this case because you might want to sample for cytology under a crust. So if you see the crust, just try to peel it off, try to get a little bit of the pus that's found under the crust. If you only have a collarette, it's definitely a lot more difficult to sample, but if it's very dry, you can wet your swab and just try to swab the edge of the collarette, not the center. The best would actually be to sample pustule. So you want to use a sterile needle, open it up, and then you want to get your sample on a swab, or you can actually do a direct impression. That's probably the best. And you'll have a very tiny little bloody sample, but that's where you'll find your bacteria. Okay. Now, there is another skin disease that can cause pustules. Those pustules are typically much larger, much more severe, and it's pemphigus foliaceus. Pemphigus foliaceus is the most common autoimmune skin disease in all species, in people, in horses, and cats, and dogs. So it's probably a disease that you have seen. And what happens is that autoantibodies are being produced, and those autoantibodies target a protein, which is a glue that holds the skin cells together in the epidermis. So the epidermis starts to slough because it's losing its cohesion. And as a result, you have free-floating cells, which are called acantholytic cells. Okay. So this is, these are the desmosomes, these little structures that hold the skin cells together. That's electron microscopy. And this is being destroyed. And now you have just lots of space between cells and free-floating cells. Those cells don't really adhere to each other anymore. So that's acantholysis on histopathology. On cytology, you can see acantholysis as well. And you're going to have acantholytic cells. They are typically 5 times larger than neutrophils. And they have they're large cells with a central nucleus and a thin cytoplasm. Have you guys ever seen those? No? So if you see many of those in a sample of a pustule, with or without bacteria, because you can have pemphigus foliaceus with a secondary infection. So it's not necessarily one or the other. But if you see lots of cells like that, and the pustules are very large, typically much larger than what you see with pyoderma. If the patient is older, not necessarily the typical young patient with allergies, you should consider pemphigus as being a possibility. Pemphigus will not respond to antibiotics, it will only respond to high doses of steroids. Okay, so just kind of, you know, in theory, how different the pustule sample will look between a superficial pyoderma, which is a bacterial infection, and pemphigus foliaceus. So you're going to have numerous acantholytic cells in pemphigus with a background of neutrophils and occasionally a little bit of bacteria, but not many. Whereas with pyoderma, you'll have lots of neutrophils, lots of bacteria. How are we doing on time? What's that? Oh, we should? Okay. So it's until... Okay. Alrighty. Well, I think we've covered quite a lot of these. I'm just gonna quickly. Okay. So we had just more just deep pyodermas and other things, but I'm just gonna show you a fun little video and then we'll stop. This was just about ear and skin cytology. Sorry, ear cytology is very similar to skin cytology, but I just wanted to show you this. This is otodectes or ear mites on video endoscopy. So the mites are just moving away from the light source, which is the video endoscope, and so you can diagnose ear mites.